Hi, my name is Makinie. I'm one half of the behavioral health team.
Hi, I'm Sarah. I'm the second half of the behavioral health team.
We're part of Student Success Services, and under that, we are academic advisors and behavioral health counselors.
So our role is really interesting. We have a dual role at the college. We both advise programs like the other academic advisors that we have in the Student Success Center. But in addition to providing academic counseling, we also provide mental health counseling, and that's how we got our name, the behavioral health team.
So when we started in 2020, we were basically told that we would be starting from the ground up. So we developed our own policies and procedures and forms. So we've created all of the intake forms. We decided when we would see academic advising students and behavioral health counseling students. We created different procedures for the referral process, and we created a web page.
We did. And we're really grateful to have the help of Edison and the team that builds the website for us because they really helped us with this a lot. But in order for us to create it, we reached out to some other community technical colleges in order for us to determine what we thought was best practices. And so a lot of the stuff that's on the page right now is best practices from, really the 34 other community and technical colleges in the state. Some of the things that I think we're most proud of on our webpage are information, how to find us, right? We're available in a lot of different ways. There is some social media availability for us, pretty much everywhere in social media. Then the thing that we thought was really important was for students to be able to connect with us without having to go through an instructor or maybe an advisor that maybe they didn't have a relationship with. So we created a Qualtrics, which is just a survey form that allows students or faculty and staff to tell us what students need, and then for us to reach out to those students, kind of leaving out a middle person. It just goes straight to us, and then we go straight to the student. The other thing about the website that I think that we're really proud of is some of the community resources we have on there. Makinie did an amazing job of putting this together, and there's so much information here. So we do have the opportunity for us to provide information to students if they need anything in any of these amazing areas, as you can see on our webpage.
The other thing that we did to get the word out, aside from social media, was started a YouTube page, in part because in transitioning to online, we wanted people to see our faces and hear our voices. So we have a number of informational type videos. So from wellness and workspace during a pandemic to racial trauma to a mindfulness exercise, a presentation that Sarah did on resilience and coping skills. So various types of trainings that we've done, information that we've provided. The other thing that we did was we teamed up with Jessica Gilmore English and Anthony Covington to help meet the Title IV standard of providing a drug and alcohol awareness program and presentation. That was an honor for us to be part of.
The other thing about this YouTube page that I think is really important for us to talk about is that it does have a lot of our classroom collaborations on it, not all of them, but it does have some of the classroom collaborations we've done. For example, we've been invited to classrooms and different college departments to talk about resiliency, coping skills, grounding activities. We were able to be at the town hall and do a presentation on actually a couple of different things at this point. And then within our own group in student services, we've been able to provide a presentation regarding VAR, which is validate, appreciate, and refer, so that we can talk about the different RTC resources so that staff and faculty know who to send students to when something comes up. And I think that's been really helpful. We also do have 3 new collaborations in the works right now. So we're working with the ECE department to provide something regarding ACEs, which is adverse childhood experiences. And then we're collaborating with CCP and ESL in order to help prevent, I think what we're calling, well, there's no official name, but it's kind of a workbook for new Americans, or a handbook for new Americans. And we think that's going to be a really interesting collaboration that's going to go on through the next quarter. Quickly, because we did see that this was one of the questions, we do want to talk about the numbers that we've received. So we have received nearly, I think last time I looked, it was nearly 90 referrals over the year for people who have encouraged students to come talk to us. And that number is, is a good start, I think. And within that number, the people that I'm currently working with and the people that Makinie are currently working with, it seems that we have nearly 75% students who are students of color. And so we're trying to provide places for people who need us to get help. One of those places is that weekly check-in that we have for staff, students, and faculty. And then obviously in our sessions, we're trying to connect with people, and we're really trying to connect with instructors in order to have them provide our information to students who may not know right away that, like, I'm feeling stressed, I should talk to a therapist.
And that's really where we're hoping to move in the future, is we want to become more integrated with the instructional staff and faculty who have direct contact with students. So we want to work more with LRCC, the library. We want to get our information on Canvas in various places, potentially the syllabus. We want the RTC community to understand that our success is based on the buy-in from staff and faculty, because the average person, student aside, the average person doesn't think, oh, I'm feeling emotionally disturbed, I need to go see a counselor. Most people go see counseling because somebody encourages them to. And so we really are hoping for collaboration with and from instructors, because they're one of the key pieces to getting students connected with us. So that's kind of what we're thinking for future goals.
And I think maybe within the next year, Makinie and I have been talking about trying to do some sort of mental health week that allows us to incorporate all of the amazing resources and sources of knowledge that we have on campus. We have a massage therapy program. We have an auto program. We have things that are basic, interests that students may have, or things that students may need to know, not just us with coping skills, but also maybe, collaborations with like the IT department on how to run a debugging check of your computer, or like what software is the best, or those sorts of things. So we're really hoping that if we could do some sort of mental health week sometime this year, in order to encourage students to take a step back, making sure that they're having some self-care, and then also that we've got some of those kind of like how-tos that maybe would help reduce stress and anxiety for students too that we're dealing with.
And so with that said, thank you so much for giving us the time to provide you with this report. If you do have any questions, you can contact us at behavioralhealth@rtc.edu. Thank you so much.